Are there any specific activities or habits that can prevent tinnitus from worsening? Health and wellness, particularly sleep habits, do a great job at preventing tinnitus from worsening. Today you're joined by 4 tinnitus experts from Treble Health. Dr. Ramsey, Dr. Diana, Dr. Suzanne, and myself, Dr. Ben. We're here today to play 20 questions designed to help you with your tinnitus ear ringing. First up, what is one reason that non-bothersome tinnitus transitions into bothersome tinnitus?
Sure, that can be our own reaction. We get scared. This triggers an emotional reaction, which then triggers our nervous system, and our body can go into fight or flight, into a sympathetic nervous system state. And here we are then listening to our tinnitus.
There can be hyper-awareness of the tinnitus after a traumatic event. It could be physical or emotional.
Personally, for me, my tinnitus became more bothersome after having a physical injury. I had a head injury, so that can happen.
Over time, most often over a period of months, life can be very stressful. And for a lot of our patients, there were things related to work, personal life, health issues that create a lot of pressure and stress in the nervous system. And then the filter mechanism in the auditory brain, which is designed to suppress tinnitus, weakens, and the tinnitus becomes bothersome, intrusive, and often louder. Why do you think there is not currently a cure for tinnitus?
That's a really good question. There's so many different causes and neuroscience theories that it makes it really difficult to come up with a universal cure for tinnitus.
I would say tinnitus is not recognized as having the same impact on quality of life as some other medical conditions like cardiovascular diseases or diabetes, although we do not agree with that.
Since tinnitus is a symptom of so many things, it's really difficult to find one cure for it.
It comes down to the amount of research and the success of those research initiatives. But remember, there are other very common conditions that also don't have a cure, like Parkinson's, epilepsy. And despite there not being a cure for tinnitus, there are treatments that can really help restore normal quality of life. What do you recommend to make tinnitus less bothersome in the morning?
I really like routine. This can start with like a hot shower, moving into a breathing exercises and meditation. Start the day off right, get the sound therapy in. I even have some patients putting their feet in hot water in the morning as the start of their routine.
I always suggest putting on sound therapy first thing, whether that's through devices or tabletop sound generator, just really enhancing the background noise since it tends to be very quiet in the morning.
I usually recommend focusing your attention onto your other senses, such as what can you see, smell, touch, and taste, and even focusing your attention on other things that you can hear.
In the morning, get out of bed, try to be active, try to get some stimulation and distraction going. That can help as opposed to just laying in bed and ruminating on the tinnitus. Do certain professions make individuals more likely to develop tinnitus?
Sure, these might be professions with a lot of noise exposure, for example, construction.
To add to that, musicians also have a lot of noise exposure over their careers or even just recreationally.
There is a high incident of tinnitus with military personnel, and we thank you for your service.
Even dentists or dental hygienists have shown signs of early hearing loss and early tinnitus. Can tinnitus retraining therapy help an individual who has had tinnitus for many years?
Yes, absolutely. Never too late to start treatment.
Yes, there are many patients that have had tinnitus for a long period of time, but still get success from TRT.
Absolutely. I've seen it work with veterans who have had tinnitus for 20 plus years.
Tinnitus can reduce even if the individual has had it for many years, and this might sound surprising, but it's true. I recently recorded a podcast episode with Matt, who worked with our team here at Treble Health, and he had tinnitus for many years. He started treatment, and after some time, he significantly reduced the baseline level, even when he took his hearing devices out of his ears. I'll link that podcast in the comments, and I really encourage you to watch it if this relates to your case history. What is one technique that helped some of your patients habituate or reduce tinnitus?
Sound therapy.
Cognitive behavioral therapy.
I had one patient where she would take a deep breath anytime she noticed her tinnitus change.
All those tools are very helpful. Also, just taking a comprehensive treatment approach, including things like sleep, stress, sound therapy, treating hearing loss, this all really helps. Describe one theory behind the origin of tinnitus.
Well, we can have somatic tinnitus, and this is tinnitus arising from the jaw, the neck, even sometimes the eyes, where information from that area on the way up to the brain gets mixed with auditory information, and this can exacerbate an existing tinnitus or create tinnitus.
There is the neurophysiologic model, which describes the outer hair cell dysfunction, which is a part of the cochlea that gives way to kind of this discharge of energy to kind of higher, more central parts of the auditory system. And there, the tinnitus is allowed to communicate with the emotional brain, which creates a link between the two. And so work on kind of unraveling that part of it.
There's a theory that when you have hearing loss, the brain can be actually checking for missing sound, and then therefore the cochlea misfiring a signal up to the brain.
Another theory many people don't know about is called the global brain model, presented by Dr. Dirk de Ritter and colleagues. Definitely worth checking out if you're interested in the origin of tinnitus and different theories that explain it. Each of you are doctors who specialize in tinnitus and see patients in our program at Treble Health. So what is your specialty? Which type of patients do you serve the best?
I tend to gravitate towards working with the somatic patient population, and that is because my tinnitus is somatic.
I specialize in the treatment of tinnitus and sound sensitivity, otherwise known as hyperacusis.
I work with the most severe tinnitus cases and specialize in CBT.
My background is mostly focused on tinnitus retraining therapy. Me and a few other colleagues have studied with Dr. Jastroboff, the founder of tinnitus retraining therapy. Are there any specific activities or habits that can prevent tinnitus from worsening?
You want to make sure that you're using ear protection when needed.
Utilizing stress management techniques to reduce stress.
You want to be consistent in using hearing aids and sound therapy.
Health and wellness, particularly sleep habits, do a great job at preventing tinnitus from worsening. If someone has tinnitus, will they also develop sound sensitivity, also called hyperacusis?
Not necessarily. Having tinnitus doesn't always mean you're going to develop a sound sensitivity and vice versa.
Yeah, so the two can exist in isolation.
And I agree, I have seen one without the other.
About 30% of my patients with tinnitus also have a significant sound sensitivity. The good thing is both of these are often treated in tandem, and there are treatments for both. How do you describe reactive tinnitus?
So reactive tinnitus is a type of tinnitus that changes in response to normal or low-level sound. And it's different from hyperacusis, and that hyperacusis is more of an oversensitivity to normal sounds.
It's a type of tinnitus that behaves differently than kind of more of a constant sound. The perception of the tinnitus tends to increase in direct response to softer or fairly innocuous sounds.
While being rare, it is when certain sounds tend to make the tinnitus seem louder and more perceptible.
I don't want anyone to overdiagnose themselves with reactive tinnitus, and one patient of mine who certainly had it shared that when he turned the radio volume up in his car, no matter how loud the radio volume went, his tinnitus was always louder than the radio. So that would be a perfect example of a truly reactive tinnitus. No matter how loud the sound is, the tinnitus just gets louder. How can barometric pressure affect tinnitus?
One way would be through the eustachian tube. If that is not functioning correctly, pressure changes are more noticeable, and that can exacerbate our tinnitus.
Yep, increased atmospheric pressure can influence pressure within the middle ear space and can cause more negative pressure buildup, which in turn creates congestion, and that can cause an increased perception of tinnitus.
Barometric pressure changes can actually affect the fluid inside the cochlea by displacing it and affect the tiny little hair cells that produce sound to the brain, causing them to potentially misfire.
In my experience, it's pretty rare for weather or altitude changes to affect tinnitus directly. That also means you can fly on airplanes, and unless you have a problem with the physical structure of your ear or your eustachian tube, flying is totally okay. What is one commonly overlooked medical condition that causes tinnitus?
Grinding our teeth, clenching our teeth, TMJ.
Anxiety.
Migraines.
Stress is often overlooked due to work, personal life, or different health issues. What devices can help treat tinnitus or hyperacusis?
This might start with hearing aids for hearing loss, as well as devices that are combination devices that also have sound therapy options.
Bone conduction headphones can be helpful for those who cannot tolerate devices in their ears.
There are some great sound therapy apps. For example, Resound Tinnitus Relief is a great app that provides sound therapy, guided breathing, and meditation.
What the research suggests so far is that bimodal stimulation is now an option, and it can provide relief for some types of patients, but worth reaching out to a professional like those on our team for an independent evaluation, telehealth consultation to determine which solution is right for you. How can someone with hyperacusis or sound sensitivity communicate their needs in a noisy environment?
Be your own best advocate with accommodations that you might need for situations that are potentially going to be bothersome.
Explain to others that everyday sounds have the potential to bother them, and so they may need to modify how they engage in social activities. This might include going out to eat at earlier times versus later times, and just communicating as much as they can for, and advocating for themselves.
I usually recommend that the patients give specific examples of what the sounds can sound like that bother them. For example, being in a shower can sound like fireworks exploding.
Definitely agree with that. That can really help someone empathize with what they're going through. So remember, guys, wear earplugs when you're around very loud sounds, and tell those around you that you need help. Name a situation that is more difficult for someone with sound sensitivity.
This can be just common everyday sounds. Even just flushing of the toilet can be difficult for patients with sound sensitivity.
Going to the grocery store can be very problematic.
Washing dishes with the clanking of the dishes and the silverware.
Eating a meal with the plates and the silverware as well. That can cause a lot of loud, sharp, high-pitched noise. What ways can you train the brain to improve tinnitus?
Improve the state of our nervous system. Move out of a sympathetic nervous system state and away from more of a heightened nervous system state.
Yeah, by disengaging the emotional response, it reduces the attention on the tinnitus and can often make the tinnitus sound quieter or more background.
Using sound therapy can actually help rebuild the neural pathways that are associating the sound with danger.
In addition to a comprehensive sound therapy plan that can help retrain the brain, research also clearly supports the treatment of hearing loss and how that supports tinnitus. So if you have a hearing loss, certainly consider hearing aid treatment that will help your tinnitus. Name one exciting new advancement in tinnitus research.
Dr. Ben mentioned Dr. D. Ritter earlier. I'm a big fan of his, and currently he's working with psychedelic assisted brain stimulation.
Bimodal stimulation has shown some promising results in helping to reduce tinnitus.
There's a research study that showed stem cells being injected through the round window of the cochlea, regenerating lost hair cells and restoring hearing.
In terms of new advancements or things that can potentially be helpful to our patients, I'm most excited about Dr. Susan Shore's research, which is bimodal stimulation using the cheek and the neck. We're hoping to see that become available in the next year ahead. Describe one overpopularized treatment for tinnitus.
Tinnitus eardrops.
Use of lipoflavonoids or supplements.
Thumping your fingers on the back of your head.
Completely agree with the supplements. There's a lot of them sold and they're not regulated or fact-checked in any way. They don't really help our patients, unfortunately. I'll also say fasting is on the internet. Some people are talking about it. I think for most people, it's not the best idea. Let's try the treatments that are likely to work instead of these alternative ones. What is one habit that someone with tinnitus should start doing today?
This might be a lifestyle change or new habit, making sure you're getting regular exercise, maybe even starting a new hobby.
Yeah, to add to that, adding in meditation, even if it's just 1 to 2 minutes a day, can actually really help to reduce stress, reduce anxiety, and take the focus away from tinnitus.
Start using sound therapy. It is a great way to retrain your brain.
Follow a diligent sleep schedule. If you want to look into that, search for cognitive behavioral therapy for insomnia and follow that protocol. What is one habit that someone with tinnitus should stop doing?
This is my favorite question. Stop searching and treat the tinnitus.
Stop consuming information from unreliable sources.
I would say stop using supplements that are really not doing anything for you.
Stop feeling hopeless because there is something you can do for tinnitus. Thanks everyone for watching, and we'll see you on the next episode. Take care. Thanks guys. This is our team at Treble Health. If you want to reach out to us, you can go to treblehealth.com or click the link on the screen. So yeah, I just want to give a shout out to all of our awesome audiologists that are here. Thank you guys so much. This was really fun. And for anyone who's watching, don't hesitate to reach out. We might be able to help you with your tinnitus case. Thanks so much.